Heart Month, and in honor of that, it's important to recognize how different factors can lead to underlying effects and what to look for in order to prevent cardiac dysfunction. KOBK's Olivia Whitehead joining us now. What signs do we all need to look out for?
Well, stress and anxiety are two major factors associated with cardiomyopathy and in some cases heart failure. Especially during a pandemic, doctors say there are a number of different ways that the heart can be affected by outside stressors, and it's important to acknowledge those signs.
Anxiety can sometimes be a vicious circle. Oftentimes patients will describe symptoms of chest pain and palpitations, and those can increase.
Even without those underlying conditions, stress can still induce temporary cardiac dysfunction in some cases.
Last week I had a patient come in with a stress-induced cardiomyopathy, came into the hospital with severe heart failure, had an elevation in some markers from their heart. Luckily, all of the arteries were open, but the heart function was significantly reduced in the setting of stress.
The good news? Dr. Jason Streffling with Covenant says it's frequently reversible.
It's important to try to prevent those stressors and to try to be able to have healthy coping mechanisms to stressors and anxiety.
Something Tandra Gale has learned to work through.
When I had to stop working, due to this pandemic, the anxiety has been, it's crippling at times. But my mom and I have always talked. I just pick up the phone and I call her. She'll pray with me. I believe it was in June. Went camping, and just to get up, just even walk and see the trees, I did not struggle one bit.
Especially during a pandemic, it's important to still find ways to de-stress.
Diseases such as seasonal affective disorder or staying inside and being cooped up in the setting of this sort of pandemic that we're in can create a lot of depression, create a lot of anxiety. So getting outside, walking around, staying active and exercising has significant cardiovascular benefit.
Now, doctors do tell us it's important not to dismiss any symptoms, even without having those underlying conditions. If you experience chest pain or shortness of breath from anxiety, they encourage you to go get it checked out. Terry?